be inspired, supported, and empowered. This is the Global Healthy Living Foundation podcast network.
Welcome to a special episode of Talking Head Pain. In this 3-part mini-series, we explore migraine from the healthcare professional's perspective. I'm Zoe Rothblatt, a migraine patient and the Director of Community Outreach at GHLF. I'll be your host for this episode. This series is part of our UP-END Migraine project, designed to help healthcare providers, especially those in primary care and emergency settings, better understand migraine diagnosis, treatment, and management. In this first episode, Earning the Diagnosis, Addressing Barriers to Migraine Diagnosis, we'll be looking at some of the biggest challenges patients face in accurate migraine diagnosis and what healthcare providers can do to address them. Joining me is Erik Stone, Director of Data, Learning, and Evaluation at GHLF, and more importantly, a fellow migraine patient and advocate. Erik has conducted a survey gathering insights from both healthcare providers and patients about barriers to diagnosis. Erik, thanks for being here. How are you?
Thanks, Zoe. I'm doing well.
So, can you kick us off by telling us a little bit about yourself, both as a migraine patient and about your work on this project?
Sure. So I've been living with episodic migraine since the age of 15. And like many patients, my journey to getting a diagnosis wasn't super straightforward. When I began experiencing symptoms, I brought my concerns to my primary care doctor, who wrote them off pretty quickly, I think, given my age, and basically told me, well, if you're still experiencing symptoms in like 3 years, come back and we'll talk about it.
Oh my gosh, 3 years.
Yeah, 3 years. And life happened. I moved. I went to college. I was seeing a different primary care doctor, and they did end up eventually diagnosing me with migraine, but they notably didn't offer any treatment or really any like serious lifestyle modification suggestions beyond like drink more water and get more sleep. And when you're like 18 and in college, that's basically useless advice. So I basically sat on that diagnosis for a while without treatment and believed that that experience was pretty normal. So when I started my work as a patient advocate, I kept hearing like, yeah, that is something that can happen pretty often. And I wanted to figure out why, which began with an inquiry into how doctors were diagnosing migraine and what resources were available to them. So at the Global Healthy Living Foundation, I help build surveys and educational content, typically for our patients, but we saw a gap in the resources that were available to providers. So with the UP-END Migraine project, we wanted to build something that helped providers and other healthcare professionals, really anyone that's working with migraine patients, get access to the most up-to-date guideline-based treatment and diagnosis practices. And that work began with figuring out with what providers were doing currently and what patients like me were experiencing. So when we conducted a survey, 2 surveys actually, to better understand the barriers to migraine diagnosis from both the patient and healthcare provider perspective, we ended up gathering responses from 285 healthcare providers, including everyone from primary care physicians to specialists, as well as over 400 patients who live with migraine. For the patients, we wanted to explore, obviously, when they were diagnosed, who diagnosed them, and what treatments they were receiving, and how they felt about those treatments. And we also wanted to see how those experiences differed based on things like race, ethnicity, gender, and socioeconomic status. And then from the healthcare provider side, we wanted to know how they were defining the diagnostic criteria for migraine, what treatments they were recommending, what treatments they weren't recommending. And I'm really excited to share what we found, especially in relation to my own experiences with migraine.
Yeah, I'm excited to learn. And first of all, I'm sorry that you got dismissed early on in your migraine journey. As a chronic illness patient myself, I know how frustrating that can be, especially when you're getting advice that is like, of course, I'm trying my best to sleep and hydrate and take care of myself, but this is abnormal symptoms, so I need help. And I'm glad that you found your advocacy voice in that journey and it led you to GHLF and working on this project. So yeah, let's dive into some of the survey data. What key patterns did we see coming up in the data regarding the most common barriers to diagnosing and treating migraine?
I'd like to describe the process of getting a migraine diagnosis as earning the diagnosis. And what I mean by that is that not only does it feel like you have to prove that your migraine is severe enough to warrant a real diagnosis, but also that that diagnosis actually has to mean something. Like I said, when I received my first diagnosis at the age of 18, there was really zero action from there, no treatment, no good suggestions, just like, yeah, you have migraine, good luck with that. So I never brought it up again with a doctor until I understood that it wasn't normal. And I'm lucky not to have super severe migraines, but for patients with severe migraine, like what we see with a lot of chronic conditions, I feel like sometimes the attitude is that because there isn't a cure for migraine, medication isn't something that's being offered when maybe it should be. And of course, there are other strategies for migraine management that are equally important and absolutely necessary. But at the same time, I think that a lot of patients already know that managing stress can help their condition. And when they're at the doctor, they're maybe looking for what those next steps need to be. And I think a lot about my experiences in connection to what we found in the survey. And there's this big disconnect between when providers think treatment should be offered, with over like 26% of the doctors that we surveyed are waiting until patients are having between 9 and 11 migraine days a month before even considering a preventive treatment option.
That's also crazy because 9 to 11 means almost half of the month is spent with headaches.
Yeah, and that's no medication to prevent the frequency of those at all until that number of days is absolutely outrageous, I think. I can't even imagine.
I agree, yeah.
So people are suffering for much longer than they have to be. And the other thing is that 59% of migraine patients are or have been under the care of a primary care provider for their migraine management. And if you compare their treatment timeline and their treatment experiences with that of those being treated by, say, a headache specialist, you see these huge discrepancies between what's happening. And if we can work towards a system that, has a little bit more consistency and is informed by a shared set of guidelines, then I feel like we can start to close those gaps in meaningful ways.
And I think you started to touch on this, but from your personal experience, like what are the personal implications of these diagnostic barriers for patients?
I can't even begin to explain how frustrating it is to be told that you're going to have something for basically the rest of your life and then not offered any strategies to do something about it. And the worst part of that was that when my doctor had the attitude that our conversation about migraine actually ended with me being diagnosed instead of beginning, I carried that attitude towards other areas of my own health. And suddenly when I had a migraine, the world stopped and there wasn't anything to be done and it was unavoidable. And this was like supposed to be like the rest of my life. And luckily since then, I began seeing doctors who have shown through their understanding of the guidelines that my previous experiences should not be the norm. But sometimes I still struggle to stick to my treatments because of that initial introduction to migraine that was just like, well, this is just how it is. And really, it's not even worth mentioning going forward because there's nothing else that can be done. So it really did influence my attitude towards the effectiveness and the importance of my treatment and just really the worth of my health and well-being. Zoe, I'm curious, you're a migraine patient yourself, and if this at all resonates with you, how these barriers to diagnosis have impacted your journey or what you've seen with other patients.
Yeah, I really do relate to it, and thanks for asking, especially around the suffering longer than necessary. I don't consider myself as one of those people in the survey that's having, half a month filled with migraines, but I was having really specific triggers like rainy days, menstrual cycle, like my arthritis flare would lead to a migraine, so it's probably around 5 or so migraine days a month. I think I had the discussion of what your doctor had with you, but with myself of it's just a headache. There's not much to do. This is just what it is when these things happen. And then working here and talking to our colleagues and other migraine patients, I realized that there's tons of treatments out there and there are such things as episodic migraine. And this is a real diagnosis. And with the encouragement of some friends, I went to a neurologist. I also don't even think I ever would have thought of seeing a neurologist headache specialist before having friends with chronic illness. I would have, like you said, in that bucket, just probably mentioned it to a primary care and not realizing it's such a specialized disease. And I got on treatment and I feel great. So I was kind of having those conversations in my head of there's nothing to do. This is just what it is. And, with the encouragement of the community, I stepped up and got care. And now I'm feeling amazing, which is why I think it's so important what you're doing with gathering these survey results and sharing insights, because I know for myself, hearing from other patients about their experiences, really informed my treatment journey.
That's great to hear. And I'm so glad that you're feeling better and found a treatment that works for you, because I feel like every time I ask another person with migraine about what was it like to get diagnosed and where are you at right now with it, everyone has a story to tell. They're always like, oh, well, let me tell you about it, right? And I think the example you provided really speaks to the positive potential of what a good diagnosis and a good treatment plan looks like, and how amazingly positive it can be when everything works in the way it should.
I totally agree. And it's really intimidating to get started. Like, I'll definitely say that I needed the support of my friends, colleagues. I was looking through the insurance portal at what, headache specialists in the area were covered. It's definitely like there's a bunch of steps to get there. But once I got there, I was like, I can't believe I didn't go at least 2 years ago, if not more. So if anyone's listening and like thinking about it, or doctors, if you're listening, like ask your patients about symptoms, get specific, because sometimes we just like don't know what we don't know. And until we have the language, it's hard to describe what's going on.
I think it's so important. If my doctor, any of the doctors that I had seen since being diagnosed and starting treatment had even just mentioned, saw it on my chart and been like, well, I see you've been diagnosed with migraine. Let's talk about that. What are you doing for that? And it just that first step, because like I said, I didn't know that. I felt like, oh, well, the last time I brought this up, it didn't mean anything. So I'm not going to say anything about it right now. It's nothing. It's just migraine, right? And if my doctor had started that conversation for me, I feel like there could have been a lot of time that I could have had access to treatment and not been in pain. So it's so important.
Absolutely. And that kind of leads into the next question I want to ask you, which is what is the impact of having healthcare providers who are well informed about migraine diagnosis on patient outcomes?
Yeah, I think it goes back to that consistency. When we're seeing and living through such discrepancies between how providers are treating migraine versus what patients are perceiving and experiencing, it makes me think that we have to do more to improve how providers and patients are connecting with each other. And 43% of the patients that we surveyed expressed that they were only partially satisfied with the treatment that they're receiving for their migraine. Yet 75% are eager to explore new treatments that may be equally or more effective than their current ones. So I think that there is a desire on the patient side to connect with providers and redefine what life with migraine can look like. And if we can work together and find that common ground, that meeting point that sets the expectations of the process for diagnosis and treatment, I think the impact would be huge. And in my experience as a patient advocate, we know that when patients feel heard and validated in their experiences, they're more likely to engage with their treatment plans, which leads to better outcomes for everyone.
Okay, so we have this survey data. It's clear, patients want newer and more effective treatments. So what steps can healthcare providers take to address these gaps in knowledge and diagnosis that we're talking about?
I think it begins ensuring an accurate and timely migraine diagnosis starts with just consistently using the International Classification of Headache Disorders criteria for migraine diagnosis, which can help catch cases early and prevent misdiagnosis. And since migraine symptoms don't always present in a textbook way, and like you said, everyone will use different words to describe how they're feeling and what's happening to them, I think it's more important than ever to have that foundational definition of migraine that providers can go back to when they aren't sure. But I'll add a caveat to consistency though, and super importantly, the survey data also highlights disparities in diagnosis that are based on gender, race, socioeconomic status. 55% of the racial minority patients we surveyed cited a lack of insurance coverage as a reason for not using their medications to reduce migraine frequency compared to only 20% of the white patients. So obviously these disparities in diagnosis and satisfaction with treatment really are impacted by so much more than what's happening in the doctor's office itself. And recognizing where patients are coming from, what experiences and circumstances that they're bringing to their appointments is also going to be crucial. And just finding that perfect balance between here are the guidelines, here are the questions I have to ask you, and how might I need to adjust this model and my recommendations based on what's going to be the most accessible to you.
Yeah, I really appreciate you highlighting that data and making your recommendation of like what's going to be most accessible, because at the end of the day, patients need to have buy-in in their healthcare and like feel like it's attainable, something they can do. I know for sure for myself, and I hear it from other patients, and there's lots of data to show that it's like when we feel like we're part of the decision-making process, we're so much more likely to, I hate that word, but like adhere to the plan.
Yeah.
So yeah, I guess my last question for you is, how does understanding diagnostic barriers lead to discussing preventive treatment? treatment.
When we talk about the barriers to getting a migraine diagnosis, I think the question, just based on my experience, is what happens after diagnosis? What is the point of getting diagnosed with migraine? And the reality is, if someone spends years undiagnosed or misdiagnosed, they're missing out on treatments that could actually prevent their migraines from getting worse. They might be relying on acute medications or over-the-counter medications, which can lead to medication overuse headaches and even make their attacks more frequent, which is why fixing the gap right now is so important. And if we can help patients get meaningfully diagnosed earlier, we can also start conversations about preventive treatment sooner if it's appropriate. Who should consider it, what options are available. So I think it's really about shifting from constantly putting out fires to actually preventing them in the first place. And we're trying to work towards normalizing this conversation about preventive treatment and when to offer it through the UP-END Migraine project. And I encourage anyone who is listening, who is invested in improving their own practices and knowledge, to stay involved in our work. Read the data, read the survey reports, engage with those modules. All the links relevant to this episode will be in the episode description.
Awesome. Well, thanks, Erik, for having this discussion with me today, telling us about your story and the work on the UP-END Migraine project.
Yeah, thanks for having me, Zoe.
Well, coming up next in our next episode of this special mini-series, we'll be talking about the importance of early preventive treatment and how providers can recognize when it's time to start it. We'll discuss practical strategies for helping patients manage migraine progression, so be sure to tune in. Well, that's it for this episode of Talking Head Pain for the Healthcare Professional. We hope this conversation provided valuable insights into the challenges of migraine diagnosis and how healthcare providers can play a key role in improving patient outcomes. If you enjoyed this episode, don't forget to subscribe to our podcast on Apple Podcasts, Spotify, or wherever you listen. And if you have a moment, leave us a rating or review. It'll help more people like you find us. If you have any thoughts, questions, suggestions, we'd love to hear from you. Send us an email at podcast@ghlf.org. Thanks for listening, and we'll see you next time.
Be inspired, supported, and empowered. This is the Global Healthy Living Foundation Podcast Network.